All right. Good morning, good afternoon, and good evening, wherever you're at and whenever you're viewing this episode of Behind the Premium. I'm excited today because we are trying something a little bit different. I've invited my co host with the most, Jacob, who is the CEO of Well Trio, to join me for a very special discussion. Jake, are you there?
I'm here. Thanks for having me.
Yep, you can hear me. That's great. That's always a positive on a Friday, right? We don't want to pull a Monday, that's for sure. But go ahead and just tell the crew all about you. I don't think we've had you officially on a Behind the Premium episode, which Alpha, we will be doing that very, very soon. So stay tuned for that. But go ahead and introduce yourself, and then we'll kind of talk about what this series, Benefits 3.0, is all about.
Sure. Yeah, thanks. As Cody mentioned, Jacob, CEO of Well Trio. I spent most of my career in tech, building startups and working with established companies. I've traveled the world implementing software solutions, working with large teams. And when I came across the opportunity to get involved with Well Trio, I thought, this is fantastic. Everybody knows healthcare is broken. There's a lot of people doing a lot of different things about it, and you can see a lot of that at the at the political level, at the federal level. But what resonated with me about Well Trio is their kind of boots on the ground approach, and I'm sure we're going to get more into that. But that's what really connected me to the vision with Well Trio, and I feel a passion for that.
Yeah,
So
for sure. That's awesome. Yeah, I'm right there with you, my friend. I don't know if it's the yellow car syndrome or what, but since I've been working with you and Well Trio about healthcare, it seems like on my social feeds, doesn't matter if it's Facebook or Twitter or Instagram, I'm finding more and more people are just constantly griping about their healthcare coverage and their healthcare benefits. And I'm pretty sure they're not saying anything to their boss because let's be honest, I think I could tell you if our insurance plan sucked or not, but I think other people would disagree with me on that. And they want nothing. They don't want to be in the radar of their HR department or their manager. So, and
yeah.
that's kind of what we're here to talk about today, right?
Yeah, and I think to your point about the yellow car, I don't think maybe there's a little bit of yellow car syndrome, but I actually think there's a lot more yellow cars on the road as the years go by. This year, there's more than last year, there's more than the year before. There's more yellow cars, man. There's more problems, there's more rate increases, there's less benefit. So I don't think I think the problem's getting worse. It's not that we're just noticing. It's definitely getting worse.
Oh, for sure. And that's why in one of our many conversations that Jacob and I have throughout the week, talking about user experience and data and just how we can make Well Trio better. We've talked about potentially doing this type of what we call Benefits 3.0, just a kind of a coffee sip and chat kind of conversation discussion. We may have a few people on as guests as we go on through the episodes. We'll try to do these weeklies, but I think for us, it's kind of more of a brain dump of things that we've noticed over the week, things that we've picked up on, things like that, topics that we are seeing trending in the healthcare space, benefit space, things like that. And so, one of the biggest things that we want to tackle today is more or less the tech stacks that brokers and HR people are using. Because let's be honest, I mean, everybody's being sold on tons of different software products to add to their tech stack. And I mean, you've got auditing tools, you've got employee compliance tools, I mean, you could probably help me list a couple more here, but at the end of the day, premiums are still going up. So why is that? So I'm going to flip that over and I'm going to start off the conversation, Jacob, with that. I mean, we've got all these great tools, but I know from you being having a great SaaS background, why are premiums going up? I think there's a good correlation there.
Sure. So, yeah, I love tools. I love tech. I'm a gadgety kind of guy. I've spent my career building tech gadgets for companies and projects. And so I love the tech and the platforms. And I don't think there's anything really fundamentally wrong with the platforms that are out there. You need to progress with the times. You need tools that are better at calculating utilization rates and predicting those types of scores. You need tools that are better at analyzing data and spend. I think the real problem boils down to what they're missing is human intervention at the point of care. So I think tech tools are fantastic and they paint the picture. And then it comes down to, what do you do with the picture? What does that mean next quarter, next renewal? And I think that's really the gap, is human intervention at the point of care. We call it healthcare logistics.
Healthcare logistics. Yep. And I agree with you. To kind of expand upon that too, you look at the software stacks that a lot of us are using within our own industries. It's interesting because, with AI starting to come out and get a little bit more autonomous, it still requires human interaction and human input, right, to make things keep moving forward. And so I love that point that you just said, the human logistics portion of it, right? There still needs to be that human connection. And I think too many industries are starting to over the years have tried to move quickly out of that and try to automate a lot of things. But that's where, let's be honest, a lot of this tech is only as smart as the people that build it and the data that they have behind it. Would you agree with me on that?
100%. It's the tech is only as good as who built it, and it's only as good as what you do with it on the user side. And anytime, like, a lot of these AI tools are great. A lot of the new things that are coming out are awesome, and they work really well for a lot of things. But you've got humans making decisions in healthcare, right? You've got employees that are patients, and they're talking to their doctor, and they're getting labs done, and they're getting blood work done, and they're taking prescriptions, and they're doing all these things, and it's a human making those decisions. And I think that's really where it breaks down, because you've got all these great, like, AI tech tools. They're really, a lot of them are pretty cool. It's amazing what they can do.
For sure.
But how do you implement it, and how do you use it? And I think that's where a lot of this breaks down, with brokers and HR teams have a lot of data available, a lot of reports, but what do they do with it?
Yeah. So, one thought that comes to mind after what you just said, if all these tools are supposed to make, benefits better, easier to get in contact. One of the biggest frustrations, and my wife and I just went to the doctor, what was it, yesterday? And it was very interesting because I hate going to the same doctor that we've been going to for 15, 20 years and having to fill out the same stupid form every single time. Why can't I not just check a box that say, yes, everything is exactly the same, nothing has changed? Or even when I go from one doctor to the other, why can't I just take my information with me? And I think that that's one of the biggest pitfalls that we have here in the United States, especially the healthcare system, is there's just a lot of private information that's just floating out there that, anybody could get access to. Some people have and some people haven't, but that's a whole nother story. Maybe that's another episode. But on the flip side it's like, if we've got all these tools to make it better, why do you feel that premiums keep coming up? And I know that you mentioned that that human logistics is one of the biggest missing components in benefit plans. But let's dive a little bit deeper into that. I think it's a little bit more than just the human side of it. Like, I feel like there's some data side missing. I feel like there are, let's be honest, like 2 or 3, software programs. They don't like to share information. They know that data is their currency that they work in. So, you've been in logistics, you've been in, data logistics, you've been in building out software. How has it been, like, integrating Welltrio's proprietary data platform in with some of these HR platforms, payroll platforms, and even kind of like broker and insurance type of platforms? How has that process been for you?
Oh man, so that feels like a loaded question. It's been a real challenge because the there's very much a human engagement that happens, um, in all of those softwares, in HR and in on the broker side. It's always a person doing something in those systems, right? I mean, a simple example is an employee gets hired or employee gets terminated. What happens? Well, somebody in HR has to go click a button, fill out the termination form, and they have to do that for liability, right? Like their name's attached to it.
Right.
And so you get these human in the loop, and humans are lazy, right? We we want to get through things as fast as we can, and maybe we don't send all the emails or we don't check all the boxes because we're hurrying or made a mistake. And that really has been one of the biggest challenges for us with integrating is, I've been dealing with this problem just yesterday, where HR is doing everything right, doing everything the way that they always have been doing it, and it's causing extra expense on the back end because notifications aren't getting sent out the right way. And so I still, I think a lot of it really does feed back to that human in the loop, and humans are, a little bit lazy, which is great. That's what drives innovation and that's what drives automation. But humans also have a lot of hubris, and so we don't like being wrong. We like thinking our way is the best way, and that's one of the big challenges. The other real big challenge is there's not a standard system. There's not a standard tie between all of these systems. There's nobody in the middle coordinating it all. And I think
Right.
a lot of people assume the broker does that. And they do to some extent, but the system's bigger than that.
Yeah.
So I think,
Yeah, and I think you bring up a good point. It's an uncomfortable question for a lot of people, right? And I think this is a great use case as to why premiums keep going up and up. I love the example that you just said, like an employee quits or is terminated and is no longer on the plan, and so they need to be removed, and that's a human interaction, right? And so it's almost like we need to draw a line between the admin efficiency and the cost reduction that happens, because I mean, let's be honest, if an HR person isn't on their game and they don't have a fully autonomous thing that automates that process for them, and they're not on their game, that could cost them extra that month because they forgot to take that employee off. It's not like they can call up and say, oops, my bad. I know we're 15 days into the month. I was supposed to remove that person 30 days ago. Can I get a refund? A lot of times it doesn't work that way, right? And so I think that that's a great example of these type of gaps that are being created, not just in the healthcare space, but just in business in general. And that's why it's good to have the efficiency of administrative audits, so to say, or have that human in the loop and have that kind of accountability type of thing. Because I think that's a great example is what we're seeing in the healthcare space. Would you agree with that?
yeah, 100%. And I want to also kind of wrap that sort of opinion around with the idea that everybody means well. Nobody's trying to not do their job well or trying to be lazy or trying to miss something. Brokers, HR professionals, everybody's doing what their best. That's what we see is everybody's doing their best and stuff gets missed, and there's a gap there.
Yeah, for sure. So let's kind of dive back into the tech stack. What are some of the tech stacks that you've been kind of working with from the broker and also from the HR perspective of trying to integrate in? Like, what are some of these things that these people are using, and why is it important for WellTrio to integrate into them?
Sure. So starting with the HR side, HRIS, HR information systems, those are the platforms that HR manages hiring and firing. I mean, this is pretty common knowledge for the HR folks, maybe not common knowledge for everybody else, but companies like Bamboo HR, Gusto, QuickBooks Payroll, I think we integrate right now with a little over 200 different HR systems. Um, and that's just been key because we can automate a trigger as soon as an employee is added or removed from the system or their status changes. We can automate triggers, and that really helps us coordinate a lot of the activities that need to happen across HR, the broker from a benefit standpoint. It helps us facilitate Cobra. It helps us engage with HR to say, have you thought about these three things, and kind of help them with the checklist if they need it. And so that's been extremely useful for us, and that's been a real challenge to integrate with all these different systems. But the juice is worth the squeeze at the end of the day.
That's for sure. That's for sure. And I wish that some of these people could listen into some of our conversations, not all of them, but just some of them, because Jacob and I love to, well, I at least love to take Jacob to where I call Mars. And we go to Mars quite a bit in vision and path and kind of moving things forward of where we would like to see things happen within Weltrio and within the industry of the healthcare and benefit space. And so there's a lot of good things cooking there. And like I said, I wish I could have a lot of people in those kind of conversations, because they could see that we're putting a lot of time, passion, and energy into this kind of thought process. And maybe if you want, we've had some really good conversations this week. I won't dive into too many because I feel like they're still pre-alpha before we want to release that kind of information. But maybe Jacob, you can feel comfortable sharing like what one thing that we did talk about is what we desire and what we want to do with bringing a lot of this data together in a kind of like data lake kind of atmosphere or environment type of thing, and why that would benefit not only a broker, an HR person, and the employer, but also the employee as well.
Yeah, sure. So Weltrio is really built around the employee. We categorize ourselves as a medical services company that works with HR and works with brokers to improve healthcare. And so improving healthcare means a couple of things. It means the employee experience is first. Are they getting the care they need? Are they getting the proper preventative care? Are we catching chronic disease before it's an issue? Are they moving towards their health goals? Every individual has a health goal. Every single person. They want to lose 10 pounds. They struggle with acne. Who knows? They've got a high blood pressure. They're at risk for heart. They're pre-diabetic. Every single person has something they want to improve. Even if on paper they're perfectly healthy, everybody's got something in mind that they want to get better at. So first and foremost is the employee. How are we helping them? How are we adding value to the employee? Second to that is sort of how we do that. And so I like to think about it like the what is the employee, care navigation, patient advocacy, things like that. The how we do it is through a personal relationship. And so our coaches work with each individual employee, and we help them navigate the system and achieve their goals. We can get better at that the more we have access to information about that employee. And so data lake kind of sounds scary when you're talking to a healthcare company. And so
it does.
I totally, that resonates with me. It sounds scary to me. I don't know if I want my data in a data lake, but I think what you have to really understand is that this is not a data lake for sale. This is not a data lake that gets licensed or leased out to anyone. This is a data lake built to enable those engagements, those human-to-human touch points with the employee. Our goal of how we do that and what we're trying to accomplish is to reduce cost through helping people be healthier, helping them achieve their health goals. And so our data systems, our data lake are all built around how do we make that better for the employee? How do we enable our coaches to ask the right question at the right time? How do we enable our coaches to set the right goal with the employee? And I think those are some really key differentiators for how we use the data. A lot of companies will, take a big pool of data, and what their product is data, right? And so if a person is providing that if a person is providing that data, they are the product, right? Nobody
Right.
wants that with their healthcare data. And the laws are, in some ways pretty strict, and in other ways you can get around them if you want. And I think that's one real key differentiator for Weltrio, is that we are driving towards that employee experience. And that's where our AI systems, our predictive analytics, all the data we collect, that's what we're driving for.
And I think that it's important to call out as well is that there is a huge data silo problem, and it's just not in the healthcare space. It's across just about every single industry that utilizes SaaS products and things like that. Because of what I mentioned earlier, a lot of them just don't like to share because that's their currency. That's what that's their value that they bring. And so they're gonna keep that really, really close to the chest, right? And so it doesn't benefit the business owner unless they can extract that data from one software and put it into another, right? And I love the example that you just gave, because I totally agree with you that it helps from enrollment data to claims data to utilization trends. I think is the biggest one. But probably the most important one in my mind is starting to identify like health patterns as well. Those are some great things, and along with that is having the accountability of a health coach advocate as well. You brought up like losing weight, things like that. Hey, it's great to have a nagging wife that wants you to get back into that swimsuit ideal bodybuilder kind of body for the summer, but to actually have a person that's proactively engaging out with you to follow up with you, I think is huge, because that's another huge call out in the sense that it's not a call bank that people call into. It's not like a scheduled kind of event that happens once a quarter, even though we do have those as well, to kind of check in. But these people are your trusted advisors when it comes to your health. I mean, I've used the analogy. I know you've used the analogy as well. Is that I don't want to do my taxes, so I go to a tax professional. I don't want to plan my own vacation, so I go to a travel agency, right? Um, and I feel like people could wrap their heads around that, but when it comes to their healthcare, they think, "Oh, I've got it. I'm good. I know how this works." I don't know what it is. It's almost like an ego or a thing that they don't want to feel or look stupid, maybe. I don't know what it is, but it just seems like people are like, oh, yeah, I know what my deductible is. I know what my premium is. I know how much my copay is and out of pocket expenses. But that's kind of where it starts getting a little bit into the gray area. And then you ask them, like, well, what's fully covered as part of your benefits plan? And then they're like, I have no idea. Right. And
Yeah.
I feel
Well,
like this is where a lot of the gaps start forming, is between data, human interaction, and software interaction. This is where they all start beginning to collide. Would you
yeah,
agree?
I agree with that. And I think, to expand a little bit on your analogy, I think we often, as people, feel comfortable selecting a plan, or we want to say, yeah, I'm good with this. Maybe I have an idea of what plan I want and I feel confident with it. Maybe not. There's a lot of people who, you know, speaking for myself, I go home and I show it to my wife and I say, hey,
Yep.
what do you think? Maybe I have a good idea, but I sure don't want to screw this up. But what really matters is when you have something happen, to your point about what's actually covered. Let's say, I go in for my regular annual checkup and they say, ooh, your blood pressure is pretty high. You got to do something about that, and they lay out, maybe there's some prescriptions I can take, or depending on the doctor, maybe there's some activities I could engage in. Well, shoot, I'm kind of worried. I'm in my 40s and blood pressure is building, and, maybe I should stop eating like I'm 20, but, maybe not. I don't know. Is it genetic? Is it environmental? And I really don't know how to approach this. I don't know what the right answer is. I don't really want to start taking medication, although that's sort of the easy path. We can get into the whole medication conversation later. Um,
For
so what do
sure.
you do?
Yeah.
Who do you call? Who do you talk to about that? And that's one of the areas, one of the arenas where Weltrio pulls alongside, and we we assist with the care navigation and that patient advocacy. We say, well, here's what each of these options mean. And, I know you because we've been meeting for, a year, a couple of years, whatever. We build a real relationship, and that's the people component that's so important. We've got a real relationship. So I know what your priorities are. I have a good understanding of your family and your situation, and I can help you sort through all that noise, right? And once we sort through the noise, I can help you execute the plan, whether it's a diet plan, an exercise plan, a medication plan. And I think that's really a key piece, right?
Yeah.
Because I know for me it is. It's a little bit overwhelming. You think you've got this, and then the doctor says something, you're like, oh crap, I don't got this.
Where's my wife? I need her here to take notes for me.
Yeah.
Yep.
Yeah, and the reason is because your wife can be, or your spouse can be a little bit dispassionate because it's not them that's getting that diagnosis. So they can take a step back and they can look at it. They're still a little emotional because they're tied. Presumably they love you, and so there's a little bit of emotion tied in there. But just imagine if you had a healthcare professional, a patient advocate, somebody on your side helping you sort through the noise, that really can do that effectively because of their range of experience and because of the patterns that are available to them to analyze. And going back to the data set and how we implement the technology, giving our coaches the resources they need in the moment they need it, and those resources can be what's worked in the past, what are alternative medications, maybe there's some ideas that the doctor didn't think of that we can say, hey, let's call your doctor together and let's ask him about these other options, right? Let's talk through this. And just having somebody that can pull alongside you like that can be absolutely invaluable.
Oh, for sure, for sure. I'm gonna do a little confession here. I don't know if this is the right move to say or not, but earlier this week, as you're aware, I was out kind of interviewing a company, getting a case study put together, and there was this kind of a conversation I got involved with. Hopefully, this was good advice, but we were just joking around, and the person asked, he's like, well, what if my wife's not available, for emergency contact? Who should I put down? And I'm like, you should put down your health advocate. And that way they contact them. They will know everything about you, your family, everything. And then that really got me thinking after I said that, I'm like, you know what? That's a great opportunity because your health advocate and team is dedicated 24/7. So if your wife's at the mall and is in a dead zone because she's shopping, or with wherever she might be, and she can't pick up that phone, at least they can call your healthcare advocate and have that point of contact. And I was thinking, oh man, if you're single, that's definitely a great thing to have, right? But yeah, I just thought that was kind of funny because we were chatting about that and just had a good chuckle about it. Because to your point, your wives are a little, show a little empathy when us guys get little sniffles here and there, and we think it's the end of the world, and then they compare it to birth and make you just shame you to death. But you know how it is. It's at least at least when you come in from working on the roof outside on your house, and you come in and your arm's like dangling, you're like, I think I broke my arm. And she's like, no, just put some tape on it, you'll be good, type of thing. You're like, no, seriously, I think I broke my arm. True story. But it was with my knee. But yeah, she kind of felt bad after that one. But yeah, no, I think you brought up a lot of good points as well. And to be honest, I think that's like one of the biggest areas too, because of employees are the most have the longest leash, I guess you could say, when it comes to healthcare, because nobody's really monitoring them per se until after the claim, right? And so you think about the broker, that's not really the broker's job to monitor the employees up front. And same thing with the HR. The HR can kind of do that a little bit, but it's not really their role or their responsibilities of that role. And so, what was that?
I've got a lot of thoughts on this.
All right, dive in. Let's hear it. I know you do. We always have conversations, so let's do it.
The reason Welltrio exists. It's 100% the reason, because, as our founder, Rhonda has said it so many times, the problem is the employees have daddy's credit card. Daddy pays the bill and nobody holds them accountable for the spend. Right? That boils down the problem. And it's true. And nobody wants to do the wrong thing, but a lot of people don't know what the right thing to do is. So they've got daddy's credit card. So the analogy I like, there's a couple of them, but I think an easy one for everybody to resonate with is, you got dad's credit card, right? And you've got a long, he said, go in the grocery store and buy stuff for the next week for dinner, right? Maybe there's no clear list, but you kind of know what you eat, right? Maybe you're in your early 20s and you're kind of figuring life out, so you have an idea what you guys eat. So you fill up your cart, with all this stuff that looks good, and some of it's healthy, some of it's garbage, because you want to get it in the moment. You're like, oh yeah, those Oreos look great. Then you get to the checkout and you pay, and you get the receipt and you show it to dad. Well, that's kind of what is happening with employee healthcare right now, and that's what we call the healthcare logistics. That employees are going to that grocery store with an idea of what they need. They've got their little plan document, and the doctor has told them something, and they've got like this sort of maybe broad list of choices they can make. Well,
or they had an influencer that they saw on TikTok or something say, go get this particular product. It's well worth it. Right.
Or ChatGPT or Claude
or their doctor. Yeah. Or something. Yeah.
Like, so there's a lot of places people get an ad on TV, you get influenced all the time. And the US is one of 2 countries in the world that allows medication companies, pharmaceutical companies, to advertise directly to consumers. So you see an ad on TV. Well, I have some of those symptoms. I'm going to ask my doctor about that. So you're sort of shopping all the time, right? And a lot of these companies will, these data companies, healthcare companies, a lot of these tools we were talking about at the beginning of this episode are geared towards the broker and HR to create really nice presentations of that data. Well, the problem is, then what? You can't return it. The employee can't return the stuff they bought. They can't return the medication. They can't return the ER visit. And so that is one of the things I just really love about Welltrio is we actually will go in with the employee. We'll create the shopping list beforehand. We'll clip coupons beforehand. We'll go in with the employee. We'll walk through the store. We'll help them find the stuff they need in the aisles. We'll check if it's on a discount coupon. We'll check if, maybe the store brand actually is the exact same thing, but it's half the price. Those types of things. Well, that employee now feels like, oh man, I'm saving money, and I've got a guide to help me through this. This is fantastic. Then we get to the checkout, and now that receipt's smaller. Well, now you've saved money before the claim happened. You've saved money before the incident. And that's what we talk about, the pre-claim analysis. We're looking at behavior, and we're trying to affect behavior. That's really the key to Welltrio, is affecting employee behavior. I went off on a tangent there, but
no, I love it. And that's what this thing's all about, is just going down rabbit holes and trying to talk about things that we've discovered over the past week. And one of the interesting things that I picked up on this week as well, in terms of data and in terms of like spending and doing stuff like that, if I could give the analogy of what is that grocery list that you're actually talking about, I had a conversation with Rhonda, the founder of Welltrio, and she was telling me about these kind of like fad diets that a lot of people go on, and they see all their friends just dropping the weight, and just practically overnight, right? And so you're thinking, oh, okay, this is something I want to try myself, and you jump on it and you struggle. You cannot lose a pound, and for some people, they actually gain weight, right? And they're scratching their head trying to figure, well, I live kind of a similar lifestyle. I eat right, I sleep, I do this, I do that, and the pounds just start coming off. And I learned something very interesting from her is that it's it's almost good for people to get their DNA tested and also their blood tested on a regular basis. And I think I'm trying to think the last time I had blood work done, and it's been a while. But I've never really even gotten my own, what was it, DNA 123 me or whatever. These kind of things. Like I know my wife and my kids have, but I've never really done it myself. But it's more or less than just trying to figure out who where your ancestry is and all that kind of stuff. It actually breaks it down. And I forgot how many points she was saying. It's like hundreds, if not thousands, of different points. And these points can tell you if certain foods like soy versus whey will help you gain weight versus lose weight, or if certain types of meats and proteins will actually have a negative effect on you, which I thought was very interesting. And again, it goes back to what we're talking about, that missing link, that data that they're not meshing together with the broader picture of that health, right? And that's something that we do as part of the Well Trio experiences, is that we encourage people to get DNA testing done. And because that helps us see the larger picture when we're helping set goals and doing things like that. And so I'm curious, have you ever had that conversation with Rhonda on that?
Yeah, so there's some interesting things around that. First of all, just this past week, we had some friends over for dinner, and we were looking at, we've all done the ancestry.com, which make your own decision about whether or not you want to do that from a data standpoint. But we've all done it, and it's fascinating the things they can tell you from the DNA. So we were looking at it says, what your characteristics are. And I think they have like 150 in that app, and it's geared towards less medical things, right? It's
right.
Like, I am predispositioned to not take naps. I'm less likely to be a napper, apparently, which is funny because I love naps. So, I think they missed on that one, but there's a lot of things. I'm a morning person. That's what my DNA says. I'm likely to be a morning person. I absolutely am. I wake up at, between 5 and 5:30 every day. That's my best time of day. I feel refreshed. There's, I'm forgetting some of these other ones, but super fascinating things that you can learn about your DNA from, Ancestry. Was it 1, 2, 3 and me, or whatever that 23 and me.
23 and me, yeah.
There's a bunch of them out there, and they tell you interesting things about your life that you might be predispositioned to. Well, Trio does that on the medical side. So we have a bunch of DNA kits that we'll send out, as needed. When we have a member or a patient that maybe gets a blood test, that we're like, there's something there, right? We kind of see some flags, and we might say, okay, this person needs a DNA test because we really need to dive deep into what they're predispositioned for. You can be predispositioned for cancers, diabetes, Alzheimer's, heart disease, liver, everything about your body medically, just about, can be sort of warned through a DNA test. And so it's just a really fascinating solution, not one that I was really aware of prior to, engaging with Well Trio. And Rhonda was talking about some of the interesting things that she's done with DNA. We actually order, when DNA kits go on sale, Well Trio actually just orders as many as we can, hundreds, because we send them out kind of as needed. It's such a value add to a lot of people.
Yeah. And I think too that, to your point, take it for whatever you want. DNA tests are great. They're very insightful. There are different levels. I think it's important to call out that there are different levels of DNA testing that you can get. The ones we do, I believe, are kind of like a full panel kind of DNA test, from my understanding. But on the flip side of that too is how important it is to get regular blood work done for checkups, because that's kind of like the lifeline of your body type of thing, that's kind of the oil of your engine to tell if it's something's actually going on. Because let's be honest, computers can only run so much diagnostics, but I mean, you talk to these good old boy mechanics that they'll sit there and they'll rub the oil together, and some I've even seen taste it kind of thing, and I'm like, Okay, I don't know if I'd go that far, but hey, they can tell if something's off, and they're like, okay, yeah, you got something going on here, type of thing. And I think that's a good analogy as to why we need to get a full panel blood work kind of done at least once a year, type of thing, at least from a screening point of view, because like you said there earlier, there might be something a little bit off, and may warrant a DNA test to see if you're cancer prone, or if you're this or that, acceptable to various chronic diseases, things like that. And I mean, I'm being persuaded. I'm one of those guys that are on the fence about getting a DNA test anyways, because I don't want a little mini Cody running around somewhere else in the world, or becoming super bad mini Cody, type of thing. But I guess what was that?
I don't know if anyone wants that.
I don't want that. I guess I watched too many conspiracy theory movies over my lifetime, but I am starting to get a little bit more warmed up to the idea of doing it. And I know that I'm not the only one. I know that there's a lot of people that even just feel uncomfortable about using the internet. They just don't want their data out there for a lot of people. And I get that. And one thing that I've come to learn working with you and various other organizations in the healthcare space is that there is so much regulation, so much compliance, and so many hoops that products and service providers that do collect PI information, personal information about patients or clients or things like that. There are so many hoops that we have to jump through in order to protect that. And I think the healthcare industry does set a gold standard for the type of data protection that maybe Target should follow. I'm just saying. Their data breaches seem like they're once or twice a year at least. So that should tell you something, compared to, it's very rare that you hear about medical data breaches. And if it is, it's very locked down really, really quick. And I think that's important for people to understand as well, is even though you're still having to fill out the stupid forms every single time you go to the doctor's office, and repeat it when you go to a specialist or to just a different doctor, and that you can't take it with you, it is still being protected. It is still. So that's a good side in there. We're coming up about 45 minutes into it. I know I've been kind of hogging the conversation here a little bit, but did you have anything this week that really resonated with you about today's topic of HR and broker tech stack and tools that they're using that you wanted to bring up that we haven't already addressed? I have a few more questions if you don't, so no pressure. I just wanted to kind of give you the floor to run with it for a minute.
No, I mean, the biggest thing, it kind of comes back to what I said earlier, is that the integrations are key. I mean, they're just so critical to be able to connect and have at least trigger to go ask the question. Even if you can't pass the data, a lot of PII or data back and forth, at least you get the trigger, the signal.
Yep.
And that's really key. And that's what we've been talking about. I've been focused a lot on that this last week, focused a lot on how to use those signals and how to help our coaches get those signals in the right way, that they can go ask the right questions, to our HR teams and to our members.
Yeah. And I think that brings up a good question there. Signals. How do you know what questions for coaches to ask? What kind of signals to pass on to HR to keep? Because I know that at WellTrio, we kind of position ourselves in between HR and the employees for that relationship, at least the health questions, answers. So we alleviate a lot of the questions going back to HR, which I know a lot of the HR people that we work with absolutely love it, because they're not having to answer all these questions about the healthcare benefits. They just have a team they can turn it over to. But how do you know what questions to ask the individual? How do you know what signals to pass on to the HR team and what to pass on to the broker?
Sure.
I think that's a good indicator too, of like, Do I want to share everything with this person? Is it going to get back to my employer? I think that's a big fear for a lot of people.
Yeah, I think you're absolutely right. And I want to clarify one of the things you said is that we don't work between HR and the employee. We work with HR and the employee. Um, and that kind of speaks to one of the fears HR has is that, oh, and how is Weltrio representing the company? Uh, how am I involved? There's a lot of fear of not being involved because HR folks want the best thing for their employees. They want the best
Yep.
program. They want their employees to thrive. They want retention to stay high, and they want recruiting to be solid, right?
Yep.
And so we work with HR to do that. We're not in between HR. We're part of the trifecta of HR, broker, and Weltrio that work together to benefit that employee. And so just wanted to clarify that. And then, to
Yep.
answer the question of what signals, I think really the biggest thing is we have nearly 11 years experience doing this. And so we've learned what signals matter, which signals matter, what gets escalated and to whom, and how does it get escalated, which I think is a critical piece of this. Yeah, your medical data is private with Weltrio. HR doesn't get to see who had who has a chronic heart issue, right? They don't get a name attached to that if Weltrio knows it. They don't get names attached to prescriptions or anything like that. HR will get here's the conversations Weltrio had, the types of conversations, the categories of conversations, and that gets escalated up. If there's high claims that happen throughout the period, Weltrio will escalate the basic information, the summary of that claim, so that HR is aware, so finance is aware. If they're on a self-funded plan, they need to know that expense is coming next month or the month after, right? They want to be able to be prepared and budget for that. That's where Weltrio can surface, a lot of those costs, and we surface sort of the, I would say, the tempo of the healthcare logistics. And what that means is, for your population, how many conversations are they having about health? How many treatment codes are being addressed? How many prescriptions are on track? Are they compliant with their prescription plan? How many employees are going to their primary care doctor? How many, stage 1 cancers did we find? That sort of thing. So we're not exposing the who. Your data is safe, but we are giving enough to HR and to finance on the client side that they can make good decisions and they can prepare and they can understand what's happening. That's actually a huge benefit when you get into open enrollment. And there's typically, there's often quarterly meetings with a carrier or a TPA, or stop loss insurance, reinsurance carriers, where they really like knowing the story behind the claim, right? If we have a high cost claim or we have a pattern of increasing claims or whatever's happening in the data, Weltrio being able to explain, well, that was, a birth, or that was an accident, or, yes, that was an expensive treatment for a cancer, but we caught that in stage 1, so it was expensive once. It's not a stage 3 or 4 treatment that's a reoccurring monthly for years type of cost. So being able to have those conversations is extremely valuable to HR, finance, brokers, and then everybody kind of on the back end of insurance often makes use of that information. So
Yeah, and I love how you basically nailed it. That missing layer. Again, I know we've already talked about that missing layer, but you brought up a really good point that tech stacks manage the plan, right? HR and brokers, tech stacks, they all manage the plan. Nobody is managing the people in the plan, in their decisions. And that's where we talk about those behavioral gaps, right? And that's where the real money and the risks start accumulating over the years as these employees are making decisions. And from my knowledge, there's some SaaS products out there that really try to fill the gap, but there's nothing that really fills it like true human interaction
yeah,
would.
I think the key takeaway to what you're saying is that most benefits tech on the HR and the broker side, most benefits tech is built to make renewal conversations easier. Very little is actually built to make the renewal number smaller.
Yep.
And I think that is a key takeaway of the technology picture in healthcare today.
Yep. So that just kind of spurred a question in my mind. If you were talking to a broker or an HR person about WellTrio, can WellTrio actually remove or eliminate the need for certain tech within their tech stack? Do you understand what I'm trying to ask there?
Yeah. Do we replace anything they're currently using? The question is that the answer is sometimes.
Okay.
Everyone loves that, especially from a tech guy. Sometimes it depends.
Yeah, sometimes.
No, it really depends. So, and what it depends on is if the client is using, if they have a wellness program or wellness tech, if they have an EAP or EAP tech, often we can replace the value that those programs are bringing. And specifically around wellness, there's a lot of companies implementing wellness tech. It's relatively cheap. It looks really good on paper, right?
Yeah.
Get this Fitbit. We'll have a steps competition, right? We'll have, a calorie competition, whatever the things are. It's all built around tech, and a lot of it's built around the employee engaging on their own. What we see with those types of programs, and this is industry wide, is about an 8% engagement rate with those types of programs. And typically it's the same 8%. And we've all worked in places where you've got, of 10 coworkers, you've got one or maybe two that jump on that stuff, because there's a little incentive maybe, it's, if I win the step competition, I get $100, or if I eat 4 pieces of fruit every day for a month, then maybe I win $50, or I get this gift card, or whatever the case is, right?
Yeah.
But it's always sort of the same 8%, and it's pretty steady across the industry. It's 8%, and so those programs really bring very little value to the organization as a whole. Of those 8%, let's say they improve their healthcare costs by, call it 50%. You've got 50% of 8% reducing costs, right? That's the real impact of the organization. You haven't increased their actual health necessarily, because there's no blood work, not usually any sort of blood work component. There's not usually a treatment component. There's not usually a prescription compliance component, because there's no relationship, right? And so it kind of comes back to, how do you change behaviors? You have to have a relationship, and you have to have trust. And you and I have talked about this a lot, so I know you're nodding your head. I've heard it 1,000 times. I've said it 1,000.
It is all about trust, for sure. I mean, with what you're talking about Fitbit, I don't know if you're using that example because I shared one with you earlier, but previously with another company that I worked with many years ago, they gave us all a Fitbit and told us, like, hey, we're going to have a company-wide competition broken down by department, and whoever walks the most gets like I think it was like $100 bonus and a kind of like a pizza party type of thing, right?
Pizza party, so you can offset the.
Exactly. I'm like thinking, okay, well, the Fitbit's kind of cool, because I mean, back in the day, Fitbits were like $150 or something like that, right? So I was thinking, hey, this is pretty cool. Well, lo and behold, 6 months later, I found out that was all a ploy to basically lower our premiums from the year previous, because we got jacked up so high that they negotiated with the insurance provider at the time that if they could get at least a certain percentage of the employees using their Fitbit during this competition period, that it was like, we'll lower your rate like by 5% next renewal period or something like that. And I felt kind of used and abused. And to me, to your point, that's not like true behavior change, right? That's what I call a hotness effect, right? It's one of those things that once I achieve it, or once I catch wind as to what really is going on behind the scenes of this kind of carrot and stick model kind of thing in my mind, it's like, all right, I'm done. My trust with you is completely out the window. Don't ever ask me to go to another health clinic or anything like that, because I know that you're just trying to pad your, save yourself some monies. But for me, working with somebody like Will Trio, it's totally changed my perspective on things, because it's not it's me that's benefiting from it. It's not, yeah, the benefits come to the company as a whole, but I'm the one that's really benefiting from it, and it's not like I'm being used as a tool. Does that make sense?
100% makes sense. Yeah. And I think it boils down to, you got to build trust, and you don't
Yeah.
build trust through deception.
Yeah,
I mean,
exactly.
right? Because there's a little more to your story, right? The health insurance company was actually not telling you where your data was going. The company was not telling you that your data was going directly to the health insurance company. So you were the product in that case, right? You were the product for the company to get a discount on their purchase, right? They were using you as an employee to purchase a reduced rate. And that feels gross. Nobody likes
Yeah.
that.
Yep.
And that, you didn't have trust with the company. That the trust you did have then got broken down even more.
Yep.
So,
Yep. And it blows my mind that companies will spend hundreds of thousands, if not millions and millions of dollars each year for a black box of data that they do not get to do anything with the data with, unless they're like a self-funded plan. But let's be honest, like that's pretty scary in a sense, it being on a self-fund plan by yourself. But like, these guys that are on fully funded plans that have hundreds of employees and they're spending millions of dollars, they get this nice little black box delivered to them sometimes 30 days before renewal. And they're like, hey, this is where all your data is. This is where you're going up. We have to jack up your rate at least 20 to 30% on your premiums because of what was inside of this black box. And there's nothing you can do with it. Yeah, you can try to analyze it, but they don't even make it easy for you to analyze. A lot of times it's just summary data of like, you had this many ER visits, this many high claim type of things. And there's not really actionable item that you can do on there. So it's like, to me, it's very frustrating. And I don't know why big corporations are not like putting their foot down, because they're the ones that are keeping these guys going, right? They're feeding the machine that's broken in a sense.
yeah. And this is something Welltrio runs into quite often, is why not make a change? If we don't like the way things have been and we don't like where they're going, what has to happen? You've got to make a change. And I think that boils down to where that's the Welltrio decision crux. You have to be willing to make a change. Right?
What's the ideal of or the definition of insanity? Trying the same thing over and over, over again, expecting a different outcome.
Yeah.
To me,
Yeah.
that's renewal periods.
and I get it. It's healthcare is it is a little bit of a black box, and it is scary. If you screw up your healthcare plan, you're going to hemorrhage employees, right? It is scary. And you've got often a vocal subset of your employees that like one thing or another, and that's what you hear a lot of times. Or so you try to align with what in other cases, you're getting pressure from maybe it's your finance team, or maybe it's operations or whoever, to reduce costs. I think almost every business right now, setting aside, some of the VC funded tech companies or AI companies, almost every business right now is in a financial crunch, right?
Yep.
There's a ton of pressure right now to increase margins. And Welltrio is a fantastic way to do that, but it requires a change. There's a lot of HR folks and a lot of employers that are kind of scared of our high touch model. And that's one thing I wanted to talk about is that high touch model doesn't replace HR. That high touch model doesn't replace the corporate culture. That high touch model enhances the corporate culture because our coaches pull in all the information about the business that they can, and this means goals, values, it's healthcare plans, it's all the ancillary benefits that the company offers, and we help the employee navigate all those programs so they get the most value out of it. So now that employee feels valued, and they value the company a lot more because Welltrio has helped them, and Welltrio in that way is representing the company.
Yeah.
And so I just, kind of touching on that, some of that trust concept with HR and, employers, Welltrio really brings a concierge feel to healthcare that most employees have never had.
Yeah. Yeah, I agree. It's interesting. As I mentioned, I did the case study interviews with a company, a client of ours this week, and one of the questions that I asked was, what was the first thought that went through your head when you found out that you had a health advocate coach and a 24/7 available certified nurse at your disposal? A lot of people were like, oh my gosh, how much extra is this going to be coming out of my paycheck? And then when they found that it was absolutely built into their benefits plan, there was no additional cost for it. It was all just part of it. A lot of them just basically hit the floor. And some were like, okay, I get what the 24-hour health nurse is all about. I get that. That's easy to understand. But I didn't quite get what the health advocate was all about. And so this, to your point, is something that's fairly new, and it's a new space that has never really been worked in. And I like to call it the pre-claim space, because nobody's working in that pre-claim space. They're always working post-claim. After, like you had mentioned, you can't take back the ER visit. You can't take back the purchase of the prescription. You can't take it all back. So that's all post-claim stuff. You can only assess, analyze, and try to correct the problem post claim data. We're focusing on pre-claim data. We're catching it real time. And I think that's huge for us on that fact there as well. So great points today. I had a couple more questions, but we're definitely over a couple of minutes. But I do have one last question. And I think this will kind of set the stage for upcoming episodes as well. What do you feel, and where do you think Benefits 3.0 should be focused on and moving towards over the next few years? Not just with this podcast, but I'm talking about like as an industry in whole, why we should be looking at Benefits 3.0.
I think the direction benefits are going is towards more AI, more automation, more hands-off, less human in the loop, to come at it from a tech standpoint. I think that can be good. I think it can be healthy, and I think it can be good for the industry and organizations. But I think the risk is that if you don't also balance that with a human interaction, I think where healthcare is going is the back end of things are going to get more and more automated, more efficient, also maybe a little more noisy, more data is available, more, there's going to be more legislation around it. And there's a lot of fantastic people and groups working on that side of it, advocating for the healthcare industry. I think on the other side of it, and we're already seeing this in some spaces, people crave a human connection. They absolutely crave a relationship. And I think as life in general moves towards AI and automation, I think companies like Welltrio that are offering a very hands-on, high-touch, relationship-based service are the future. I think that really is the future. I think patients and really the healthcare users, their interaction is going to be with people. They want it to be with people. It's their health. It's personal. You can't automate a personal feeling, right? And so when you're dealing with that and figuring out what to do, you want to have a face that you know and you trust in front of you, helping you deal with it. Even if everything else on the back end is automated, I think that's that's where we're headed. And I think it's going to be pretty exciting. And I'm excited that Weltrio is sort of at the forefront of this. We're new, and it's, sometimes that's a difficult place to be in the market, but I'm absolutely thrilled that we're doing it.
Yep. I agree. So thanks for taking time out of your Friday and dressing up for me. I appreciate it. I don't think you got the memo that it was supposed to be casual Friday, but hey, I appreciate you coming dressed for success and to have a very professional conversation with me. And thanks to everybody that's tuning in live or even just listening to this on the recording. This will be a new series brought to you by Behind the Premium, which is sponsored by Weltrio. And Jacob and I will be chatting about some of the topics and trends that we're seeing as we move towards that Benefits 3.0 era, as well as having some special guests on with us that are kind of innovating and kind of moving the needle. And so if you guys have topics that you want us to talk about, definitely give us a comment below or a DM and let us know what you guys want us to talk about, because like I said, Jacob and I have numerous conversations throughout the week, and it's a lot of fun as we kind of go to what I call Mars and back. So with that being said, thanks everybody for tuning in. Don't forget to like and subscribe. We appreciate it. It helps us beat the algorithms of YouTube and all of the other social media channels we're broadcasting to as well. So thanks again for your time. Jacob, have a great weekend, my friend. And any last words you want to say as well on the intro out?
Have a great weekend.
All right. Easy enough. I love it. Okay. Thanks, everybody. We'll catch you on the next week. We're going to try to do this every Friday, right?
Yep.
There might be a few misses here and there because of summertime coming up, but I think we'll try to hit as many as we can. But be ready to go every Friday at 10 a.m. Mountain Standard Time. Okay. See ya. Have a good one.